Welcome to The Explainer. Today we are diving deep into a medication called Oxcarbazepine. We're going to look at how it works, what exactly makes it a next-generation drug, and, of course, cover its uses and some really important risks you need to know about.
All right, so let's get right into it. At its most basic level, oxcarbazepine is an anticonvulsant. That's just a fancy way of saying it's a drug designed to stop or prevent seizures. Simple as that. But, the real story here is, well, it's about more than just what it does. It's a story of scientific refinement. So let's dig into what makes this drug so different, and honestly, a pretty big improvement on what came before it.
So oxcarbazepine is actually what's called a structural derivative. It's built from an older, really well-known drug called carbamazepine. You can basically picture scientists taking that original molecule and, giving it a smart little tweak.
And the goal here? It was simple, but honestly, pretty brilliant. They wanted to take everything that worked in that original version and just engineer a smarter, more tolerable update. So, to really get how they pulled that off, we've got to look at what's happening inside the brain.
All right, so how does this thing actually work? How does it stop a seizure, which is basically like a big, uncontrolled electrical storm firing off inside your brain?
Well, it all comes down to controlling these tiny, tiny little gates on your nerve cells. They're called sodium channels, and they are absolutely crucial for how our nerves fire and talk to each other.
Okay, so check this out. When a seizure is happening, neurons are just firing way too fast. What oxcarbazepine does, well, its active form, is it comes in and acts like a gatekeeper. It latches onto those sodium channels and basically locks them in an off position for a bit. This makes it way harder for the neuron to keep firing like crazy, which calms everything down and stops that seizure from spreading. Pretty cool, right? But that's not even the whole story. In fact, the most important innovation here is what happens after you take it. How your body actually processes or metabolizes the drug.
And that brings us to the key question, right? Because the answer to this is what reveals the drug's biggest advantage. It really all comes down to the chemical path it takes once it gets inside your body, specifically in the liver.
Now this is the crucial part. Look at the original drug, carbamazepine. When your body breaks it down, it uses a process called oxidization. The problem is, this creates this nasty, toxic byproduct called an epoxide, and that little thing is responsible for a lot of the side effects and drug interactions. But oxcarbazepine, the update, it was so cleverly designed to be broken down by a totally different process, reduction, and this path completely, 100%, bypasses the creation of that toxic stuff.
And why does that matter so much? Well, it's huge, because it directly translates to a drug that's just way easier for people to tolerate. It avoids that major source of trouble, which means it has a much cleaner, simpler profile once it's in your system.
Okay, so we've talked about the science, but how does this all translate to the real world? Who's actually using this drug? Let's take a look.
Its primary FDA-approved job is treating a really common type of seizure, known as partial onset or focal seizures. And it's pretty versatile. You can use it all by itself, that's called monotherapy, or you can use it alongside other anti-seizure meds. Plus, it's approved for both adults and kids.
Now, because it's so good at calming down nerve activity, doctors sometimes prescribe it off-label. What does that mean? Well, they use it for things other than seizures. The big ones are as a mood stabilizer for bipolar disorder and also for some really tough nerve pain conditions like trigeminal neuralgia. That's a condition that causes just awful facial pain.
Okay, we've talked a lot about how it's better tolerated, but, and this is super important, no medication is risk-free. None. So it's absolutely essential that we talk about the potential downside.
So, what are the most common side effects? They're usually related to the central nervous system. We're talking about things like dizziness, feeling drowsy or tired, headaches, maybe some nausea. A lot of the time, these are tied to the dose and can get better or even go away completely as your body gets used to the medication. But there's one key warning we really have to highlight. It's something called hyponatremia. It's a big word, but it just means a potentially dangerous drop in your body's sodium levels. See, the drug can make your body hold on to too much water, which dilutes your sodium. This can be serious, so doctors will almost always monitor sodium levels with blood tests, especially when you first start taking it or if the dose changes. Now, there are also some serious risks that are rare, but you absolutely have to know about them. First, there are severe, life-threatening skin rashes. You might hear them called SJS or TEN. The risk for these is way higher for people who have a specific genetic marker, which is more common in people of Asian descent. Then there's an FDA warning that applies to all antiepileptic drugs about a small but real increased risk of suicidal thoughts. And finally, a severe allergic reaction called DRESS that can affect multiple organs in the body.
And one last thing, a really critical drug interaction. Oxcarbazepine can actually make your liver process other drugs faster. A big one here is hormonal birth control. It can make birth control pills less effective, so it's absolutely crucial for people to know that they might need to use a backup non-hormonal method of contraception.
So, when you put it all together, this quote really just says it perfectly. It's a story of Oxcarbazepine is all about smart drug design. It's about keeping the powerful effectiveness of the original, but wrapping it up in a package that's way safer and just easier on the body.
You know, this drug really is a great example of a leap forward in pharmacology. It's all about taking something good and making it even better. And that just leaves us with one final thought, doesn't it? As our understanding of the brain, of our own genetics, keeps getting better and better, what kind of amazing refinements are we going to see in the next generation of medicines? What's coming next?